Hi friends, hi doctors. I want to introduce eMedica. Why should a doctor prescribe eMedica, or why should a doctor associate with eMedica? I would like to, before I talk about eMedica, I would like to discuss a common problem which every patient faces or every doctor faces. A patient faces a problem that the medicines aren't being effective prescribed by a specific doctor or by any doctor. Is it that the doctor is prescribing a wrong medicine? Answer is no. Then why it is that a patient keeps hopping around with various doctors that I'm not, this doctor's medicines aren't being effective, it is not working on me, my parameters are still not up to the mark, there are still problems, my HbA1c is still high, or my cholesterol is still high, my liver size has gone up. Basically the problem remains within the patient, which a patient doesn't understand. The main problem within the patient is that the lifestyle of the patient, not sleeping properly. Because of not sleeping properly, the accumulated fat gets accumulated, the fat gets accumulated over the liver, the fat remains within the bloodstreams where it converts into cholesterol, or further ahead it could convert into a blockage as well. So the accumulated fat does not allow any chemical to penetrate in the bloodstream, whether this chemical was taken orally through a medication or it was produced through a liver. Your liver produces various chemicals. It could be around 500 to 600 different kind of chemicals. These chemicals, they penetrate in the bloodstream to keep your body parameters right. But most of the time, the chemical does not penetrate in the bloodstream because of the accumulated fat over the blood vessel. So what am I talking? In medical terms, we term it as insulin resistance. Insulin resistance is accumulated fat in and around the cell. It does not allow the uptake of insulin, or it does not allow uptake of any kind of chemical which was taken either orally by any prescribed by any doctor, or produced naturally by your own body organs, with your own body organs. So what does eMedica do? What is eMedica? How can I give a solution for the same? How can I stop patients hopping from one doctor to another doctor? How can I make medicines more effective and rebuild the immunity? Reduce the stress of the medicines. I cannot eliminate the medicines, but reduce the stress of the medicines. eMedica is all about correcting the electrical parameters of the human body. So what are these electrical parameters? In our syllabus, in the MBBS books, or it could be homeopathy or Ayurveda, we study our entire body is electrified. Our body carries electrical charge. Our 32 trillion cells are negatively charged. Healthy cells are negatively charged. So what is the cell voltage? The cell voltage is minus 70 to minus 90 millivolts is a healthy cell voltage. A diffuse cell could indicate you're unwell. A diffuse cell can be converted into a canceric cell. Say a plus 30 volt cell or a plus 50 volt cell is a canceric cell. So what does this device do? This device passes electrons, balances your electrical parameters. By passing electrons, balancing your electrical parameters, we are improving immunity. Balancing your immunity can make medicines and your body organ function up to the mark, allow the medicines to be more effective. One. Second thing, this device is passing a microcurrent. A microcurrent which is 70 milliamps current, which is completely safe to use. We've been seeing a pacemaker implant in use for donkey years. A pacemaker implant use which we've been observing for multiple years. Has it any side effect? No, it doesn't have any side effect. It enhances the muscle cell charge and allows the heart to pump properly. So like this, we can allow any organ to function up to the mark. There could be limitations with the organ function because of aging effect, or maybe because of the cell is dead, or any other. There could be limitations. Definitely yes. But improving the immunity, allowing the organ function, and burning the fat. How do we burn the fat? A microcurrent passes through your bloodstream which burns the fat in and around the cell and improves the uptake of insulin or any other medicine which was consumed by any individual or which was produced by your own organ. Improving the uptake of chemical, improving your blood circulation will allow the medicines to be more effective and improve your blood parameters. So why a doctor should prescribe this? If you want the medicines to be more effective for an individual, prescribed by you, you need to prescribe eMedica as well. This would allow the medicine's uptake in the bloodstream. One, it will build the immunity up to the mark. Two, third, it will improve the organ function. So overall parameters with chemical and electrical balances together would be more better than just chemical balance. I don't say chemicals are not effective, or I don't say that only electrical parameters, correcting electrical parameters would be the only solution. I say balancing both together would be an ultimate solution for any human body. So join hands with us, explore the association, explore the benefits joining hands with eMedica, a long-term benefits of joining hands with eMedica. This device is already cleared its FDA, has cleared the CDSO approvals, has ethical papers uploaded, has clinical trials uploaded, has more than 10 medical publications in place and 20 more publications in pipeline with the data of around 13,000 patients. We request all doctors across country or across the globe to join hands with us